Greetings, loved ones. Today we are beginning a new series and we're going to talk about senior abuse and neglect. Help us get these messages out. Subscribe to our channel, follow us on Facebook, Instagram, and Twitter. Hit the like button, hit that notification bell, and please share these messages with others. You never know, just by doing so, you could save a life. We're going to start with some key facts. Around 1 in 6 people over 60 years and older experience some form of abuse in community settings. Rates of elder abuse are high in institutions such as nursing homes and long-term care facilities, with 2 in 3 staff reporting that they have committed abuse in the past year. Rates of elder abuse have increased during the COVID-19 pandemic, and elder abuse can lead to serious physical injuries and long-term psychological consequences. Elder abuse is predicted to increase as many countries are experiencing rapidly aging populations, and the global population of people aged 60 and older will more than double from 9 million in 2015 to about 2 billion in 2050. So let's have an overview of what elder abuse is. Elder abuse is in a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distress to an older person. This type of violence constitutes a violation of human rights and includes physical, sexual, psychological, and emotional abuse, financial and material abuse, abandonment, neglect, and serious loss of dignity and respect. So what is the scope of the problem? Elder abuse is an important public health problem. A 2017 review of 52 studies in 28 countries from diverse regions estimated that over the past year, 1 in 6 people, that's 15.7%, aged 60 years and older were subjected to some form of abuse. Although rigorous data are limited, the review provides prevalence estimates of the proportion of older people affected by different types of abuse. Data on the extent of the problem in institutions such as hospitals, nursing homes, and other long-term care facilities are scarce. However, a review of recent studies on elder abuse in institution settings indicates that 64.2% of staff reported perpetrating some form of abuse. Emerging evidence indicates that the prevalence of elder abuse in both the community and in institutions have increased during the COVID-19 pandemic. A U.S. study, for instance, suggests that rates in the community may have increased as much as 84%. Globally, the number of cases of elder abuse is projected to increase as many countries have rapidly aging populations. Even if the proportion of elder abuse victims remains constant, the global number of victims will increase rapidly due to population aging, growing to some 320 million victims by 2050, as the global population of people aged 60 years and more increases to 2 billion by 2050. So what are the consequences? Elder abuse can have serious physical and mental health, financial, and social consequences, including, for instance, physical injuries, premature mortality, depression, cognitive decline, placement, financial devastation, and placement in nursing homes. For older people, the consequences of abuse can be especially serious and recovery may take longer. So what are the risk factors? Individual level characteristics which increase the risk of becoming a victim of abuse include functional dependency or disability, poor physical health, cognitive impairment, poor mental health, and low income. Individual level characteristics which increase the risk of becoming a perpetrator of abuse include mental illness, substance abuse, and dependency, often financial, of the abuser on the victim. At the relationship level, the type of relationship, for example, spouse, partner, or child parent, and marital status may be associated with an elevated risk of abuse, but these factors vary by country and region. Community and societal level factors linked to elder abuse may include ageism against older people and certain cultural norms, for example, normalization of violence. Social support and living alone reduce the likelihood of elderly abuse. So what can we do for prevention? Many strategies have been tried to prevent and respond to elder abuse, but evidence for the effectiveness of most of these interventions is limited at present. Strategies considered most promising include caregiver interventions, which provide services to relieve the burden of caregiving, money management, programs for older adults vulnerable to financial exploitation, helplines and emergency shelters, and multidisciplinary teams, as the responses required often cut across many systems, including criminal justice, healthcare, mental health care, adult protective services, and long-term care. In some countries, the health sector has taken a leading role in raising public concern about elder abuse, while in other, the social welfare sector has taken the lead. Globally, too little is known about elder abuse and how to prevent it, particularly in developing countries. The WHO has a response. That's the World Health Organization. In line with WHO's global strategy and action plan on aging and health and the UN Decade of Healthy Aging 2021 to 2030, WHO and partners collaborate to prevent elder abuse through initiatives that help to identify, quantify, and respond to the problem, including synthesizing evidence on the prevalence, consequences, determinants, and interventions to prevent and respond to elder abuse, particularly in low and middle income countries where data are limited. Disseminating information to countries and supporting national efforts to prevent elder abuse, and also collaborating with international agencies and organizations to deter the problem globally. According to the WHO, 1 in 6 seniors above 60 years of age will experience abuse. The question is not if you will encounter a victim of violence. The question before God is, what will you do when you do encounter them? You could be the person who saves a life. You are called. We are all called to be champions for justice, and those who suffer violence need to know that those who love them and those who don't even know them will step out and reach out to them to give them the courage and the help to leave before it's too late. Help us get these messages out. Please subscribe to our channel, follow us on Facebook, Instagram, and Twitter, hit the like button and the notification bell, and please share these messages with others. You never know, just by doing so, you could save a life. If you are a victim of violence, listen to me. You are valued. You are loved. You are intelligent. You are beautiful. God does not want you to suffer violence. He wants you to live free from violence in peace and tranquility. There is a way out. It is not your fault. Abuse is not love. If you are a victim of violence, reach out to someone. If you find yourself in a dangerous situation, call 911 for help. If you know of a senior suffering violence, tell the authorities. In our next episode, we will talk more about elderly abuse. Until then, God bless you.